My name is Dick Clapp. I'm a professor at Boston University School of Public Health, and I teach courses in environmental health. And in particular, I'm interested in how climate change affects public health and will affect public health in the future. This is the number one environmental threat that's facing people in the next generation, or perhaps the next 2 or 3 generations, as the climate warms and gets more unstable, as there are extreme weather events that affect people in such a way that they have to become refugees. That's why Oxfam is involved in this event tonight, is because they're focused in particular on environmental refugees. That's a huge problem that's already happening and will happen more in the future. I teach a course called Great Calamities and Their Consequences for Public Health. And so this is a great calamity. I actually teach about this. This is a great calamity currently and in the making. And it will have a profound impact on how people can live in their environment, or how they will be vulnerable to extreme hurricanes, floods, droughts, both actually. It's what we call climate instability that's the issue. And so this is what we teach public health students will become the most important public health issue of the coming generation. The ones that I teach are public health students. They know it. I mean, they understand that this is important and that it will affect future generations' health. Particularly in the developing world, the global south, for example, and a lot of students are interested in global health these days, and so this is definitely on their agenda. When there's an outbreak of, say, cholera in some place that didn't have it before, or malaria has spread higher up in altitude or further toward the poles, toward the South Pole in particular, because the mosquitoes can live there now. That means more and more people. We have now 40% of the world's population is in areas where they're vulnerable to malaria, and that's going to increase to 60% over the next 30 years or so. So public health students get that, and get that this is important and that we need to do something to try to slow it down or reverse the trends. There are a lot of standouts in our classes, and we're proud of our students, actually, and how idealistic they are, and how they're not going to accept that this is inevitable and nothing can happen to change this. We still have, powerful idealists in our young people. Events like we're having now, this particular event, and then the publicity around the Copenhagen climate change conference, the COP15 as it's called, are consciousness-raising tools, if you will. And so I think it's the media, I think it's the electronic media like we're talking about here, getting the word out that this is something that's real. It's not, resisting the sort of naysayers that say, oh, well, this is just natural variation, there's nothing to worry about. We have to keep pounding away that that's not the case. This is actually something different that we're facing, and has millennial consequences and so forth. So how do we change people's behavior? Well, that's another thing. As we all know, this is an overdeveloped country, and we've gotten used to all of the appliances and the wasteful resources that we have. And so how generations that we've now had grown up with that change their attitude is a huge problem. I think it's less a problem in the rest of the world, and even in Europe. There's countries in Europe where there are people who've been using their cell phones for now almost a decade or 2 decades or more. They get it too, and so there are pretty drastic efforts to either tax carbon, for example, or in countries like Switzerland or even Iceland, where they have alternative sources like geothermal, they're moving in that direction. So we're the problem, I think, in this country. And so our problem is bigger, and how to change the consciousness about our overconsumption habits. All I can say is we have to keep pounding away at the message. And I'll teach public health students. Hopefully public health students will go out and talk to the general community and spread the word that way. I'm enjoying it so far, and I'm expecting that there will be some inspiring speakers, and Ben Soleil will be an inspiring musician. There's another musician who's playing right now who's terrific, and so I'm just expecting to have a good time, and that the money that's raised by this event will support 2 important organizations that will continue to do this kind of work. Oxfam is very, very important on the environmental refugee issue, and RDC is a very important policy intervener in this country and internationally. So I'm enjoying seeing that we're raising funds to help them do their work.